everybody. My name is Dr. Nicole Vilardo. I am one of the Gynecologic Oncologists at Valley Mount Sinai Comprehensive Cancer Care. I'm here to talk to you today about the Human Papilloma Virus, also known as HPV.
My name is Cecilia Godoy. I am one of the general pediatricians working with Valley Medical Group.
Hi, I'm Dr. Falguni Shah. I'm a pediatric infectious disease consultant at Valley Hospital, and I'm here today to answer some questions about human papillomavirus infections from the community.
So question number one, what are some of the symptoms of HPV?
Most commonly, HPV infections are completely asymptomatic. So most people who have HPV infections don't actually know it because there are no signs and symptoms of the HPV infection.
So that is why it is very important for women in particular to have an established gynecologist that they see for their annual well women care and make sure they are up to date with their pap smears, which can also detect HPV.
If they do have symptoms, there are certain types of the virus that causes genital warts, so penile, anal, or vaginal warts. And there are also other types that will cause cancer.
I know my child is not having sex, so why do I need to get them vaccinated? HPV vaccination can only help preventing an infection. It is not going to help, or it's not going to be efficacious to treat an infection or a disease. And so the vaccination has to be given before any kind of exposure can happen.
Studies have also shown that the immune response is stronger when given at a younger age. So with that meant, usually you need fewer shots if given at a younger age versus at an older age. Next question. Will this encourage them to be sexually active?
There are several studies that have shown that HPV vaccination status does not influence the age of sexual debut or the likelihood of sexual debut.
The next question. Since boys don't have a cervix, why do they need to be vaccinated? This is a very good question and one that we get often. The HPV vaccine protects against HPV-related cancers. These HPV-related cancers can affect males. They include penile cancer, anal cancer, cancers of the head and neck, and the HPV vaccine can also protect against anogenital warts, which can affect men.
By giving it to boys, we are also reducing the transmission to sexual partners. How many doses are recommended? So the Center of Disease Control and the American Academy of Pediatrics, they recommend routine vaccination for all children between 11 and 12 years of age. Usually you need 2 doses of the vaccine when you are given between the ages of 9 and 14. Anyone older than 15 years of age, or if you are immunocompromised, you will need 3 doses.
What are the long-term effects of this vaccine? The vaccination has been studied by the FDA. It's an extremely safe vaccine, and it has been shown that the antibodies in response to the vaccinations last more than 10 years.
No long-term negative effects have been linked. There are always acute effects that can happen, such as arm soreness and swelling, and any vaccine given at this age has a little bit of higher risk of fainting episodes. So we do recommend staying in the clinic for 15 minutes after injection as a precaution.
How do we know this vaccine is effective? The vaccine itself is up to 97 to 99% effective in reducing HPV infections, and this is particularly effective in people who have never had an HPV infection before. So that is why early vaccination and early prevention are most important in decreasing HPV infections and therefore decreasing the precancerous and cancerous lesions that it can lead to.
How does HPV lead to cancer? So HPV is a DNA virus, and it has a predilection to squamous epithelial cells. And so it can affect the squamous epithelial cells in the oropharynx, the perianal mucosa, the vulva, the vagina, and the cervical mucosa as well.
HPV is a virus that makes proteins, and they start to turn normal cells into abnormal cells, which eventually leads to precancerous and cancerous lesions.
If you have any more questions, for more information, please visit our website.